All right, well, thank you so much, everyone, for joining us for our last cause talk of the campaign. My name is Melanoma Charles, and I am the CFC Outreach Coordinator for the Cascadia Zone. So today we'll be talking to 5 amazing charities under our Community Improvement and Medical Research category. Just as a reminder that our portal closes on the 15th, so that is just a few short days away. So hopefully, if you haven't already donated or set up your donation, please do that as soon as possible. All right, so looking at then and now, we have over 5,000 charities to support here in this campaign in the last few days. So far, we've already collected $1.5 million in Cascadia, and we're hoping in this last few days to receive whether in financial donations or in volunteerism, about 200,000 more. So we've gotten quite a bit of money in volunteer pledges so far. So hopefully we can exceed some of these local aspirations that we've had, and everyone that's on can exceed their goals. So just as a reminder, you can make your pledge at cascadiacfc.givecfc.org, or you can make your CFC giving from our mobile app. Well, how do you use that? I am going to talk straight from this. You can download the app and then sign on or create an account. Also, if you previously had an account, you can also see if that account is there also. You can search for charities. Some of our amazing charities on this call today, I'm sure will be there. You can give, and then you go ahead and complete that donation. So please make sure to use either one of those options to give to either our amazing charities today, and or you can give to several charities.
And Melanoma, I'll just add that all 5 of the charities can be found under the CFC app. If you look under events and you do a search for Cause Talk, and you put in the Cascadia CFC zone or the city or state that you're in, and then these 5 charities will pop up, and you can donate directly to them through the app, or you can select other charities of your liking also.
Absolutely. Thank you so much, Phil. That's what teamwork is about. All right. So today we are going to be talking to 5 amazing charities. We're going to talk to Fred Hutchinson Cancer Research Center, Child's Play Charity, Melanoma Research Alliance, Brightfocus Foundation, and then Downtown Emergency Service Center. And you see those CFC codes there. They will also have their CFC codes in their presentation. And then at the conclusion of their presentation, they will also provide their CFC code and their contact information in the chat. So Jackie, do you have a presentation, or are you gonna just be talking to us with just you?
I have a presentation, so I'm going to share my screen.
Awesome. Okay, I'm going to stop sharing my screen. And oh, sorry, before I stop sharing my screen, I forgot. Obviously, this has already happened, so you can see some of the amazing cause talks that we've had. So if you've missed any of them and you're interested in learning about the charities that we highlighted previously, please consider looking on our website, and you can find those cause talks. We also had some amazing international and national CFC cause talks as well. So hopefully you can find those as well. So I'm going to stop sharing my screen. And I will, as we let Jackie prepare, I'll tell you a little bit about Jackie. She is the program coordinator for annual giving. Fred Hutchinson Cancer Center is dedicated to the elimination of cancer and related diseases as causes of human suffering and death. So The floor is yours, Jackie.
Great. Can you all see the presentation?
We
No.
can see an amazing, cute picture.
Oh, sorry about that.
Facilitators.
Those are some of my volunteers. Sorry
Oh, your
about
volunteers.
that.
Even better, even better.
Okay, great. Hopefully this works. Just a moment. Okay, I feel like you can see my second screen now. Sorry.
Yes,
Oh,
we can
that's
see the
okay.
second screen.
Okay. I'm gonna try this again. I'm gonna stop sharing and then try this.
Oh,
one more
no
time.
problem, no problem.
Sorry, y'all.
No problem, but just as a reminder to some of our federal employees, you can also volunteer, like we saw some of the amazing volunteers. If you look up some of our organizations, they have volunteer opportunities as well. So, all right.
Okay, great. Hopefully this worked.
That looks great.
Awesome, thanks. Okay, so hello everyone. My name is Jackie Monstring. Thank you for the introduction. I am very grateful to be here. Thank you to the CFC for having us, and I look forward to hearing about all the other amazing organizations with us today. I'm going to talk about Fred Hutch. So Fred Hutch is home to over 3,000 employees and around 230 scientific faculty. We're located in the South Lake Union neighborhood of Seattle, and our campus is continuing to grow. We're building some new buildings right now to continue our work. Our mission is the elimination of cancer and other life-threatening diseases. And we researched 3 critical areas, which is the cause, treatment, and prevention to end human suffering and premature death. We're also really focused on making curative treatments accessible to all patients. So we were founded in 1975 by Dr. Bill Hutchinson. Our organization is actually named in memory of Bill's brother, his name is Fred Hutchinson, and he was a local baseball hero and also was an MLB coach for a few years. He unfortunately passed away of lung cancer, and thus his brother established the organization in his name. We're also one of the first institutions of our kind in the US, and we're dedicated exclusively to finding cures for devastating diseases. I'm not going to go through this whole timeline, but this kind of just gives you an idea of everything that has happened at the Hutch over the years. So we were founded in 75. And we performed the first successful bone marrow transplant in 1979 with an unrelated donor. We established first cancer prevention program in the nation. We've had 3 Nobel Peace Prizes awarded to our amazing scientists. We opened an immunotherapy clinic in 2016. And we launched an HIV vaccine trial that had some early success in 2017. So this is just kind of a snippet of some of the great work that we've done over the years and the discoveries by Hutch investigators that really have put us on the edge of these new and exciting treatments. So Fred Hutch has been involved in research collaborations and clinical trials in a lot of parts of the world, as you can see from this map. We also lead the Global HIV Vaccine Trials Network in Cape Town, South Africa, and we partner with the Uganda Cancer Institute in Kampala, Uganda as well. So we do have a global reach, even though we are headquartered in Seattle, and that's where most of our work does happen. And so we've been in the news a lot in the past 2 years regarding the COVID-19 pandemic. And Fred Hutch has actually been studying viruses almost as long as we've been studying cancers. And so you may ask, we get asked a lot, why does the Cancer Research Center have virology expertise? And it's because many cancers are caused, directly or indirectly by viruses and other pathogens. For example, the HPV virus has been linked to cause cervical cancer. So that's just an example of a virus. And like we've learned this year, people with compromised immune systems are more vulnerable to viral infections, just like with the COVID pandemic. And actually, more than 20% of Fred Hutch researchers have had active projects in the response to the COVID-19 pandemic and COVID-19 vaccine development. And we have a whole division dedicated to vaccine and infectious diseases that kind of tackled COVID when it appeared. We opened the COVID-19 Clinical Research Center on our campus in 2020, and the center is really focused on studying SARS-CoV-2 positive participants, so the virus that causes COVID-19, and they're conducting phase 1 through 3 clinical trials to find effective treatments for SARS-CoV-2 positive study participants. And also in July of 2020, we were named the coordinating center for the vaccine clinical trials of the COVID-19 Prevention Network. So we were working very closely with Dr. Fauci and his team in the development of the COVID-19 vaccine. So a lot has changed, since COVID, and we've had to shift some of our priorities as well with the work that we do. This is the last thing I'm going to present on, but I wanted to highlight a study that some of our researchers have been working on and are currently working on. It's a study led by HiCOR, which is the Hutchinson Institute for Cancer Outcomes Research. And HiCOR is really driven by the belief that every cancer patient should receive the highest quality of care, regardless of their social or financial situation. And so, they're really focused on looking at ways to improve the effectiveness of cancer prevention, early detection, and treatment services in ways that reduce the economic and human burden of cancer, not just the physical. It's not just focused on physically how people are affected by cancer, but emotionally and financially, and etc. So the focus of this specific study was on financial toxicity, which is a documented consequence. And it doesn't just have to be cancer, but it could be any medical diagnosis that focuses on a range of material, psychological, and behavioral hardships, which could be debt, bankruptcy, financial worry, etc. And HiCOR really was looking at how can we leverage data to understand the financial burden of cancer. So just as treatment can cause physical side effects, it can also cause harmful financial side effects. When a person is diagnosed with cancer, they might have to quit their job. They might have to spend a lot of money traveling to get to, where they need treatment, or paying for rent somewhere else. So looking at not even the cost of treatment itself, but all the other factors that play a role. And part of the study looked at bankruptcy specifically. So you can see they did collect data through the Cancer Registry in Western Washington. They looked at credit reporting, claims data, and I focused on bankruptcy here because we had this data. It's a little outdated, but you can see that the rate of bankruptcies for cancer patients is much higher than folks who don't have cancer. And in general, the rate of bankruptcy for cancer patients is actually 2.5 times higher than those without cancer. And studies like this show that financial hardship affects the likelihood of timely treatment initiation, medical adherence, and even the likelihood of survival. And the results from this study were that patients who filed for bankruptcy, their mortality risk was actually 79% higher than those that did not file for bankruptcy. And results did vary by cancer type, but it just proves that economic impacts on survival rates are so crucial as well. And so HiCOR is really, and Fred Hutch is really focused on working with our healthcare partners and trying to shape healthcare policy to make it more accessible and affordable for everyone. So Yeah, that's kind of just a cool research study that we've been working on for a while that definitely impacted me a lot when I read about it. So I wanted to share that. And that's all I have there. If you have, I don't have like a super dense science background, but if you have like a specific scientific question, you can reach out to me. My email and my phone number are on there, and our CFC code as well that I'll copy into the chat as well. So yeah.
Thank you so much. Any questions for Jackie with the Fred Hutch Cancer Research Center?
I had a question. Something that popped out to me that like piqued my interest on the page with the timeline was the most recent, I think it was like steam plant or something like that. Can you just give like a very brief explanation of what that is?
Yes. So in 2020, we purchased, or I think we're renting it, I'm not exactly sure. We acquired the steam plant building, which is actually a historic building in the East Lake, South Lake Union area of Seattle. And we actually, because we needed some more lab space specifically for our immunotherapy clinics and labs. And so we completely kind of like gutted it and converted it to space. It's about a 5-minute walk from our main campus. And, you know, in South Lake Union, it's a lot of Amazon buildings, Google now. So it's really compact in there. So finding like space for new labs is really hard. So yeah, that's a great question. So it's a really cool historic building. You can actually see it from I-5 freeway. It's like on the smokestacks. There's like, it says Fred Hutch on it. So yeah.
Very cool. Thanks.
Yeah.
Awesome. Any other questions for Jackie in the Fred Hutch Cancer Center? All right, well, you can always ask her questions in the chat. And Jackie, if you can add your contact information with your CFC code in the chat, that would be amazing. Thank you so much for the presentation.
Thank you.
All right, next we'll move on to Child's Play Charity with Kristin Carlile, who's the Director of Philanthropy and Partner Experiences. Child play improves the lives of children through the power of play. And I know when I heard of Child's Play, I totally thought of a different thing. I'm from that generation. So
the movie.
Thankfully, exactly. So thankfully, it's not exactly what I first thought of. It is an amazing organization, and we will give you the floor.
Okay. Well, Jackie, that was amazing to hear about Fred Hutch as well. So we're really going to go from research and all of the great work that you're doing to the power of play in children's hospitals. And while we do some research, it's around gaming. So it's a little bit different as I share this. So I created one slide for Child's Play. We kind of have a plethora of things, but I thought with all of the great nonprofits you're hearing about today, I could be pretty succinct in sharing the mission of what we do. So Child's Play is an international nonprofit organization. We are one team based out of Redmond, Washington, founded there really during the height of similar to the rhetoric that happened just a few years ago about that gaming is bad, it ensues violence. Our founders, who have been lifelong gamers and have a business in gaming, said actually gamers are really good and they care a lot. And so they did a little stunt to work with Amazon and created a wish list and raised over $250,000 worth of toys and games to be sent to Seattle Children's that filled their empty rehabilitation pool. And Seattle Children said, well, great, we cannot handle this every year. You guys are going to have to change your course a little bit. So we were founded under that premise of sharing gaming is good and gamers are good. We now support 190 children's hospitals all over the globe. So we have 155 in the United States and 40 in Canada and Europe and Asia and Australia, and work primarily with either family support services or child life departments. And our real focus in that is, do they have the right gaming and technology to help children thrive during their time in the hospital? So in thinking about that and what we do, it can be anything from supporting virtual reality to gaming consoles to MRI goggles that help distract a child while they're in an MRI and can feel not that they're not having sedation, so we're reducing their medical costs, but they can feel safe and secure in being distracted and be able to talk to the medical technician at the same time. So we support our hospitals in several ways. We impact about 1 million children a year in our hospitals based on inpatient and outpatient visits with the games and technology we have. Recently, in 2017, we started a program called Pediatric Gaming Technology Specialists. And these specialists are dedicated to helping kids game while they're in the hospital. And so they also manage the equipment. If you can imagine, like Texas Children's is a great example. They have over 900 Xboxes, one in every room, and every one requires an update. It requires making sure they have the right games loaded and all of those things. And there's no central system through Xbox to be able to deploy that. So it's a lot of work to make sure that kids have some gaming at their fingertips. They also have robotics so that if kids are in their room and can't leave, they can actually use an iPad to go kind of have some fun around the hospital, whether that's an Easter egg hunt, it's going with their class field trip to a museum. We want to make sure kids are still having the same experiences that their classmates are having who are well, and that they want to interact with them in a unique way. So those game tech specialists, we funded 31. There's actually 50 across the globe right now, but of those we funded 31. It's a 2-year capacity building grant that we do with the hospital. 36, that's the number of grants that we just supported last year in equipment. And as I mentioned, that can be VR, that can be AR, that can be robotics, any of those things inside a children's hospital that will promote distraction, play, education, things of that nature, STEM, all of those things. 7, that is actually the iPads for Kids program. So we worked with Bungie to create and found the first ever iPads for Kids program. This is a program where every patient room in these 7 hospitals has an iPad that is actually managed remotely through their electronic medical record. It is built based on the child's affliction, their age, and their gender, and has appropriate games for them on the time of their stay. Once they have been discharged or have moved rooms, the iPad is wiped and then ready for the next patient. And this has allowed nursing staff and others to have a form of distraction in the room when kids are having pokes or procedures as well. And that program started 3 years ago for us, and we raised about $4.25 million in 2020. We're just getting our 2021 numbers together, but about $4.25 million that we dispersed amongst all these hospitals. And so really when I think about Child's Play and a little bit of the research that we're doing or creating, it has really been about decreasing sedation for patients, in addition to looking at how we can use distraction during procedures, lumbar punctures, other things like that. We just hired for Colorado Children's Hospital our first game developer, and she's actually working with the hospital and with the doctors to look at what we need to have inside game development to also use that in the medical community for kids. So some pretty impactful things happening in our arena and our world. And so while I know you're going to hear about a lot of great charities today, we really believe in the mission of the Power in Play, and that we hope you'll consider donating to Child's Play. And I don't know if there are any questions.
Any questions for Kristin with Child's Play charity? Well, I just have a quick question. What hospitals are you currently in the kind of greater Seattle, Washington, Idaho kind of area?
Yeah, Washington, we have Sacred Heart Children's Hospital in Spokane. We have Multicare, which Mary Bridge Children's Hospital, and Seattle Children's, which was our first. Idaho, we have St. Luke's and Boise. There actually is a really awesome interactive map on our website at childsplaycharity.org, and it lists every hospital that we have in the globe, and you can link to their Amazon wish list and either purchase items or learn about their hospitals from there.
Awesome. Thank you so much for that. And I think it's so amazing to have, what did you say? You have a gamer that can help you all create some of the games. I'm just thinking of so many different opportunities, even to kind of give the kids maybe age appropriate information about what they're going through in the hospital. That is so amazing. Thank you so much. Any other questions for Kristin and Child's Play charity?
I don't have a question, but I just wanted to comment that I feel like this is such a great thing, especially like right now during the COVID times and how that's impacted, you know, the way life is in hospitals. So sounds really awesome.
It's been amazing to see the interaction that we have been able to have because many of our hospitals were shut down during the pandemic, right, with no visitors or one parent. And so for children to be able to participate in school and talk to their friends and also see their other parent or siblings, and that integration through the virtual connection has really opened up more hospitals to, they've had such high firewalls and worried about, you know, patient sensitive information with electronic medical records. They're now seeing there's a safe way to do it, which is rad. We even had a patient use a robot to graduate last year with one of our game techs. So they put a gown on the robot and it went across the stage in graduation with her face on the iPad and she was controlling it from her hospital bed.
What amazing.
It was amazing.
Wow. Well, thank you for that information. And if there are any other questions for Child's Play Charity or for any of our organizations, please feel free to add them to the chat. Kristin, if you can add your contact information with your CFC code in the chat, just in case we may have someone that wants to contact you at a later date, that would be amazing. Thank you for a great presentation. So now we'll move on to Melanoma Research Alliance. Renee Osioni is the Development Associate. Their mission is to end the suffering and death due to melanoma by collaborating with all stakeholders to accelerate powerful research, advance cures for all patients, and prevent more melanoma. All right, Renee.
Awesome, thank you for the introduction. And also I just want to thank everybody for being here today and taking time to listen to all of these wonderful charities. So we can start on the next slide. And I just want to give a bit of background information about what melanoma is for those who are not familiar. So it is the deadliest form of skin cancer. And the ability to spread widely or metastasize to other parts of the body is a unique characteristic of melanoma compared to the more common skin cancers such as basal cell carcinoma and squamous cell carcinoma. About 1 in 50 Americans will be diagnosed with melanoma in their lifetime. And experts believe that 9 out of 10 melanomas are caused by an overexposure to UV radiation, whether that is from the sun or indoor tanning. And we can actually skip ahead 2 slides. The next slide is just MRA's mission, which we already heard. So I want to just show a little bit about our funding. So we have funded $131 million in funding towards melanoma. And the breakdown of that right now is about 90% of that is going towards research on treatment. But in recent years, we have been investing more in the prevention and early detection of melanoma, because when melanoma is caught early, it is highly curable, highly treatable. When it is caught at a later stage and it is metastasized to other parts of the body, that is when these other treatment options are needed. So that's kind of where, we want to invest more in that early detection. So since our founding, 13 treatments have been approved by the FDA, and our funding dollars have had an impact on each of those treatments. We have also supported 58 clinical studies and trials and over 211 unique therapeutic approaches. So we really have our hands in a ton of different places in melanoma, and there's been a lot of exciting advancements. So if we could go to the next slide, I just want to highlight our award mechanisms. So we support both individual investigators and collaborative team projects in many different ways. And all of our proposals go through a rigorous peer review from our grant review committee, which is comprised of various experts in a ton of different areas across cancer research. So like I mentioned previously, we're starting to dive a little bit more into prevention and early detection. So you'll see our dermatology fellows program. We're in our 3rd year of that. So that's been a direct effort there. Just to highlight our Young Investigator Awards, which funds those who are in the first 5 years of their first faculty appointment. So we're really trying to cultivate a career in melanoma or a career in dermatology, for example, with the dermatology fellowship. And through all of these different mechanisms, The data that our funded scientists are generating has informed research in other cancers such as colon cancer, breast cancer, brain cancer, leukemia, lymphoma, the list goes on. So if we could go to the next slide, I just wanted to highlight some of our upcoming special emphasis areas, specifically improving prevention and early detection strategies, as well as developing treatment to treat difficult to treat melanoma subtypes. So the next slide, if we can move there, is going to talk about those melanoma subtypes. So if you look at this diagram here, those in red, the uveal, mucosal, and acral, are the 3 rare melanoma subtypes. So cutaneous melanoma is the most common form of melanoma. That's just melanoma of the skin. But these rare subtypes are not necessarily attributed to UV radiation. So they form in areas that are not necessarily sun exposed. So because of the fact that, you know, they're forming in areas that people aren't necessarily checking their skin for, they're often diagnosed at a much later stage, which leads to a much worse prognosis for patients. And when that happens, you know, there's less patients who are able to enroll in studies because their prognosis is, you know, poor. So far we've invested $13 million into that rare melanoma research. But we are looking to do more there. So if we can move on to the next slide, I want to highlight a specific initiative that we have been developing over the pandemic, and that is our rare melanoma registry. So it's specifically for acral and mucosal melanoma patients. So like I said, these subtypes are extremely rare. And these patients are often the only or one of a small handful of patients at their cancer clinic with this specific diagnosis. And because of that, it has been really difficult for patients to connect with each other. It's been difficult for researchers to gather clinical information, whether it's tissue data, genomic profiles, and get a better picture of this community of patients. So the rare registry is going to bridge that gap. We have been creating it for the past almost 2 years now with a group of patients and clinicians and researchers. So we're really tailoring it to all of their needs to get the best outcome. So we'll be asking patients enrolled in the registry to provide data over time, not only just qualitative data, but we also will be gathering more quantitative data on their quality of life, because, you know, not only finding a cure, but also preserving their quality of life and advancing it is important to researchers as well. And again, outside of the data side of it, it will give these rare subtype patients a platform to connect and just find community, which is so important when you're diagnosed with cancer, because it can be so isolating. So we are really, really excited about the registry and where that is heading. And then if we could go to the next slide, I just want to highlight an event that we do annually, which is our Patient and Advocate Forum. So every year we bring together a couple hundred of our funded scientific researchers, and they share published data with each other. And it's just like a really exciting, to get everybody excited in the melanoma space. But we also, during that same conference, host a day for patients, advocates, caregivers, family members who have lost someone to melanoma. And what's so great about this day is that, you know, we're bringing together the patients and the researchers, and often, you know, researchers are in the labs, they don't see the patients, the oncologists see the patients. So, you know, it's great for both groups to just be in the same space and just talk about melanoma. Next slide, please. And out of this slide, I just want to highlight our clinical trial navigator, which helps get patients matched to a melanoma trial that's right for them. All therapy for cancer that is FDA approved first went through a clinical trial, and there's currently 400 melanoma focused trials recruiting patients. So we are trying to make it as easy as possible to get patients to those trials, and, you know, break the stigma that a clinical trial is a last resort, because that's not necessarily true. And then the next slide is just, in summary, thank you all for your time. And just to say that 100% of donations that we receive go directly to research. So every dollar we've received from the CFC has gone towards our mission. And I want to wish you all a wonderful week. Thank you.
All right, any questions for Renee and the Melanoma Research Alliance? You can unmute yourself or you can add a question to the chat.
Renee, when you talked about the 100% that goes directly to the cause, do you have an endowment that's covering salaries then, or someone that funded that for you?
Yeah, so our founders, husband and wife, she had April melanoma, which is one of the rare melanoma subtypes. So they fund all of our salaries and events. So any donations we get go directly towards our mission and research.
Amazing.
Yeah, good question. Good question. Any other questions for Renee? The rare melanoma registry has me like super nervous because I continually have sinus infections. So I'm like, whoa, uh-oh.
Well, if you ever want more information on the rare subtypes, let me know. I'm happy to provide. And yeah.
What is the more, the one that people primarily are diagnosed with? I know it said that 30% of individuals usually have a melanoma in the body or the trunk.
Yeah, so melanoma most commonly, and it's like, up to 90% is of the skin, and the ones that are like, shoulders, arms, legs, those sun exposed areas. Out of the 3 subtypes that I mentioned, April melanoma, which is found, can be in nail beds, palms, soles of feet, is the most common out of those subtypes, but it's still incredibly rare. And it's more common in people with skin of color, actually. And they have worse prognosis when it comes to those rare subtypes.
Is there a specific reason why?
Yeah, there are a couple reasons why. One is because the rare subtypes, like they're in hidden areas. So when these patients finally notice, it might not be a mole. It could be something internally that, the cancer has metastasized. And also there's a lack of education when it comes to like dermatology and melanoma and skin cancer on people of color, both in the dermatology community and that community themselves, because obviously, melanin does protect you from the sun, but those subtypes aren't related to the sun. So it's still important to have education about those subtypes where sun exposure doesn't matter.
Now you really have me nervous about my sinus.
Okay. Gosh,
so enough about me. All right, well, thank you so much. If there's any other questions for Renee and the Melanoma Research Alliance, please don't hesitate to add them to the chat, as well as Renee will add her contact information with her CFC code in the chat. Thank you so much for your informative presentation.
Hi, Melena. This is Heather. My video is not working, but I did just have one comment to add to Renee's presentation, which I enjoyed hearing about today. We got to do one a couple of weeks ago together, another event. But I just wanted to mention how much I really enjoyed hearing about the patient and advocate forum that you all do. We're always looking to brainstorm ways, to engage the community and patients that have Alzheimer's disease. So I really appreciate that. And I think it's a wonderful idea. I'm sure they do too, especially offering the hybrid option now with COVID.
Yeah, it's been tough getting people together with COVID, but we still want to try. And yeah, it's been really great for us bringing together the researchers and patients. So thank you.
Absolutely.
Absolutely. Good point. Good point. Well, next we will be learning more about Brightfocus Foundation. Heather Broussard will be representing them, and she is Director of Corporate and Foundation Relations. Brightfocus Foundation drive innovative research and support awareness to end diseases of the mind and sight.
Yes, thank you so much. I'm representing our Alzheimer's disease research program and definitely appreciate being with all of you on today's Cascadia Cause Talk. It's always an honor to be a part of the Combined Federal Campaign, which is a wonderful platform to share about, all of the important causes that you're hearing about today. So if we can start with the next slide. Like you said, Melena, Brightfocus is a nonprofit that envisions a world free from diseases of mind and sight. Our mission specifically is to fund innovative scientific research worldwide to defeat Alzheimer's disease, macular degeneration, and glaucoma, and then provide education on these diseases to the public. Alzheimer's disease is the 6th leading cause of death in the United States. It's an irreversible degeneration of the brain that causes disruptions in memory, cognition, personality, and other functions. It eventually leads to death from complete brain failure. More than 5 million Americans age 65 and older are thought to have Alzheimer's disease. And by year 2050, this number is predicted to increase to nearly 13 million. So with these alarming and rising numbers, it could very well be affecting someone very close to you. Next slide, please. Alzheimer's disease research program has awarded nearly $200 million since 1985 to support promising research to continue pursuing efforts to seek effective treatments, preventive measures, breakthroughs, and ultimately a cure for this disease. Most recently, the program has awarded 59 grants valued at $14.1 million to promising researchers at institutes and universities across the world, bringing our total to 149 active research projects. Next slide, please. Here we'll share a video, and you will hear from one of our recipients and researchers of a recently awarded grant.
Brightfocus gives grants to junior people as well as established investigators that lets you really test novel ideas without having to get a huge grant from, let's say, the National Institute of Health.
Brightfocus was the first major funder of my lab.
Brightfocus Foundation supports innovative research to end Alzheimer's disease, macular degeneration, and glaucoma. Brightfocus has awarded nearly $200 million to researchers worldwide. These funds have helped grantees receive numerous scientific awards, including 2 Nobel Prizes, 49 MetLife Foundation Awards, 34 Potemkin Prizes, among countless others. Brightfocus Foundation. Cure in mind, cure in sight.
Next slide, please. We welcome researchers from the global research community to bring forth their best ideas in research projects. We have 2 grant award programs for investigators studying Alzheimer's. The standard award is $250,000 over 3 years for researchers who have already generated some amount of preliminary data. They often will still require significant progress before they can apply to governmental or industrial funding agencies, so this grant really helps to kickstart their research. The next award is the Research Fellowship Award, and it provides $100,000 over 2 years and is intended for young researchers in their final stages of mentored training. These awards are designed to fund projects in an established laboratory that will serve as the basis for the applicant's own independent research career. All of our research proposals are reviewed by the Alzheimer's Disease Research Scientific Review Committee, which is composed of established, well-regarded clinicians and investigators from universities and research institutes worldwide. All the applications are carefully peer-reviewed and rated by members of the committee on the basis of scientific merit and the relevance of the research to improving understanding of the disease and promoting better prevention and treatments. Next slide, please. Specific studies and projects we fund range from genetic testing to discover how genes and variants contribute to Alzheimer's, how sleep may lead to long-term effects of the disease, and a new blood test that has been pioneered to predict brain pathology in people with memory and other cognitive issues. We are honored to fund research and support scientists internationally spanning more than 10 countries. All research projects currently underway are highlighted in our annual yearbook, and a link to that yearbook can be found on our website, which is brightfocus.org. Next slide, please. Our hope is to find a cure for Alzheimer's while also providing community outreach to address health disparities and equity for people living with this debilitating disease, as well as their caretakers. One way we're doing this is with a new virtual community outreach series called Brain Info Live that we launched last year. This campaign brings a sustained awareness and education to clinical research centers across the United States, and it addresses equity, diversity, and health disparities. We work with community leaders and partners to offer culturally tailored information and resources during each program. Those interested in viewing these episodes or participating can also sign up through our website. We have other opportunities to engage participants through our other programs as well. We've just decided to do this to offer virtual engagement to all of the community. Next slide, please. Any donations raised may be designated to fund Alzheimer's disease research and projects currently underway. All of them significantly helps us to be a step closer to finding effective treatment for those impacted and ultimately a cure for this disease. Here are some examples of how contributions, no matter the size, play a role in impactful research across the globe. We hope you will consider a gift to Alzheimer's disease research and offer hope for those diagnosed, living with, and fighting this disease every day. Thank you again for your time, and it's such a pleasure to be with y'all today.
Any questions for Heather and the Brightfocus Foundation?
Yeah, I had a question. Could you just give an example of what a personal protective equipment would be in relation to Alzheimer's?
You're talking about PPE?
Is that what that was in reference to? I wasn't sure if it was in reference to like a patient or the labs.
Yeah, it's typically a patient. That's just one of the examples that we are given, for anyone that is currently hospitalized with the disease, or they're suffering with, other complications as well.
Gotcha.
Good question. Any other questions for Heather?
I just wanted to mention, in regards to that, just with COVID, it definitely heightens the awareness for the elderly population, and that's who is obviously affected by this disease. So we've just tried to do everything possible, to keep them healthy. It could be, in an assisted living facility or memory care unit, nursing home. So it's definitely best to do whatever we can as a community to make sure they're healthy overall.
Yeah, thank you for that. So I think we talked last week, and as a person that has several family members that have succumbed to Alzheimer's disease and dementia, I'm interested, I heard you say something about the kind of coming together of information in regards to sleep in Alzheimer's disease. I'm wondering how does that connect?
Yeah, absolutely. It's been interesting to see a lot of the studies done recently on sleep and how it affects or it can lead to Alzheimer's. This one in particular is about a new blood test. But as far as sleep, it can start with people as young as in their 20s or 30s, and then just monitoring just daily sleep, records and patterns, as far as it's broken or not enough. It's never been more important to be sure you're getting plenty of rest, as this could be like one of the several risk factors later down the road.
Okay, so it's saying that maybe not, if you're not getting the enough sleep, that is suggested that you're higher likelihood of developing Alzheimer's at an older age?
Yes, unfortunately so.
Okay, note to self.
That's right.
All right. I'll be making sure to get my 8 hours. Well, if you don't have any questions for Heather right now, feel free to add them in the chat for the duration of our cost talk. And Heather, please also, I see you already added your contact information and your CFC code. Well, thank you so much for this informative presentation. Thank you again. All right, last but not least, we have Downtown Emergency Service Center, where Nicole is the annual fund manager. Downtown Emergency Service Center provides housing, shelter, health services, and crisis responses to thousands of homeless and formerly homeless people every day. So I will give the floor to you, Nicole.
Thanks so much. Can you see what I'm sharing right now? Yes? Okay, perfect. Excellent. Let's just start from the beginning. So Like Melanoma said, my name's Nicole. I'm actually now the employee giving manager. Ooh, fun title change at Downtown Emergency Service Center. And our CFC number is 22677. Unlike the other previous charities, I'm actually going to talk a little bit more about how our housing and healthcare. Oh my gosh, of course I got called right now. Okay. How our housing and healthcare actually affects our community more than just certain diagnoses. But basically, DESC is pretty up there as far as housing and healthcare service for those experiencing homelessness in the Seattle area. So we offer a lot of services, and it's going to be hard to narrow it down to just a few. I'm going to give you a little bit of a broad overview here. We're one of the largest emergency shelter and permanent supportive housing providers in the Seattle area. Emergency shelter, you're probably all familiar with, is mats on floors usually. We had to change with COVID, of course, to a hotel system where people have their own hotel rooms, and that's been just fantastic. We'll see what happens in the future with that. But our main focus is on permanent supportive housing and making sure we're meeting people where they are and helping them with the issues they have right now. If you don't know, permanent supportive housing is a type of housing in the nonprofit housing community where it's a little bit self-explanatory, right? It's permanent. We want to help people who are chronically homeless, who've been living out on the streets for a year or more, have some place to be that they don't ever have to leave unless they want to. Supportive, 24/7 casework is always available. We've got nurses on site and on call, and we always want to be able to help someone with even the littlest problem, like they want to have a friend there to walk their dog. And of course, it's housing. It's the same basic dignity and respect that everyone deserves in getting a safe place to live that supports their needs. So we have 14 buildings of permanent supportive housing. That's over 1,400 units so far, and we're building 3 more in the next year. We always want to be expanding the amount of housing available to people. And every single one of our services, both in our buildings that we own and in our other spaces that we rent, are mental health and chemical dependency services. If you visit any one of our buildings, you will be seeing, and if you need, for example, mental health counseling or any kind of care, you can get it there. Every one of our programs is designed to meet the needs of clients who can not access or use other community resources. And this is often because of the way housing programs are set up, where it's a goalpost system, right? You attain sobriety, you get on a certain medication, and then you get housing. But we use a housing first approach, which you may have heard of. It's, again, it's something you're trying to be self-explanatory about. We give people the housing first, and then hopefully once they settle down a little bit and they get used to that, they'll reach out for help, and we want to always be available to help them there. So I touched on this a little bit already. The people that we tend to serve, because there is no one person that really encapsulates the whole of the experience of homelessness, are people who have one or more usually pretty severe mental illnesses and problems with substance use. And of course, there's all kinds of secondary issues that come with that, like a poor credit history, a criminal history, an eviction history, and also a lot of medical complexity. A lot of our clients tend to actually be older now, and that's been an ongoing trend in the homeless population in Seattle. So they need more help with things like mobility, tracking diabetes and other kidney issues, and other long-term chronic healthcare issues. So we tend to serve the most vulnerable people in our area. We're very big with innovation at DESC. Like I mentioned about housing first earlier, we were actually one of the first people in the area, organizations in the area. We worked with a few others like Plymouth to create the housing first philosophy and how that looks in implementation. And that's now actually the dominant service approach in national policy in the US, which is very exciting. We also created the VAT, or Vulnerability Assessment Tool, which is how we get to a little bit more granular detail about what services and how people want to be treated when they get housing. Unfortunately, that's not used in King County, but it's preferred by the Canadian government, and I will take that win every day. All of our programs also go through a ton of evaluation because we're not afraid to try new approaches. We want to do what works. So we're often working with UW Medicine, Harborview Clinic, and the UW School of Sociology to keep testing things that we think work well, but we don't necessarily know. And things can always change because our client base can always change. So you may wonder what this housing looks like. By design, we try to make it look like a regular apartment building. Our clients deserve just as much safety and dignity in their housing as anyone else, and we really, by design, want to make it feel that way. So this is Aurora House, which is in North Seattle. You may notice that first floor is gray and brick, and that's where we have all of our private rooms for things like nurse visits, counseling appointments, and just general casework. Those top 3 floors are where we actually house people. And so anyone in one of those housing units can call down to get services anytime they want. They don't even have to get in the elevator if they want it. Like I said, we want to treat all of the people that come to us and need housing from us with dignity. So we give them a full kitchen, a bedroom with a view if we can afford it. Some of our housing parcels are a little bit weird, so they don't always get the nicest view, but that one looks pretty nice. Got a whole mountains and trees. It's better than my view. Anyway, and then ADA accessible for every single unit. Like I said, a lot of our clients have multiple healthcare issues. So that bathroom, very large, very beautiful. Every time I have toured one of our housing units, I'm just so jealous of the bathrooms. So how does the CFC help DESC and other nonprofits? There's 2 big ways. For us, one of the most important ones is a guaranteed unrestricted income source. And I can't stress how much that's important, right? You're all government people, you all know how restricted funding and granting works, and really there's a lot of limits there. But when it comes to some of our client needs, especially during COVID, we've had to pivot real hard. In March 2020, we actually had to start isolating some of our more at-risk clients, right? Because they couldn't medically afford to get COVID, and neither could we to actually help care for them while they were positive. So we were able to use unrestricted income from sources like the CFC to create a brown bag lunch program that would give them a healthcare appropriate meals twice a day. And we're able to continue doing that for almost 2 straight years because of unrestricted income sources like the CFC. It's a really direct way to impact our clients. And personally, I prefer a payroll donation. That's just money out of my check that I don't have to think about. So it all works out, and it supports a great cause that I love. We also, this one's a little bit tricky. It's an excellent source of volunteers. Usually, past 2 years have been kind of weird, but we do have online opportunities if volunteering helps you at all. We really appreciate that the CFC gives us like a formal space to connect with people that otherwise wouldn't know about our mission and otherwise wouldn't be able to reach out to us directly. So it's a really great way for you to make a very big and direct difference in our services. So thank you again. My name is Nicole. Very happy to take questions now or at any time, and I'll post my information in the chat.
All right, awesome. Any questions for Nicole?
I do have a question. I picked up on your use of the word clients, and I feel like that was like an intentional thing that you all do. So I was wondering if you could just explain that to everybody.
Yeah, so again, there's a lot of weirdness about the narrative around homelessness. We don't feel like anyone that we're serving has no choice in where they're going or what they're doing, and we want to provide them the absolute best care. So when it comes to the services we choose, not only are they usually medical services, because we see over 8,000 people a year, but we only have housing for 1,400 of them. You know, we want to give them dignity and choice in the matter, no matter what stage they're at. So they are our clients. They're people that we serve, and we will always serve them as long as they want us to.
Good question, good question. And I know that we're a little bit over time, but I wanted to ask one question. If people are interested in the volunteer portion or maybe doing something that is online to assist because of COVID, how could they support Downtown Emergency Services Center?
Yeah, that's a great question, because we've been fumbling with that a little bit too, now that Omicron's come up again. Previously over the summer, we had some more in-person opportunities, and with smaller groups, we're confident that in the next month we can continue those. If you want to come to our assortment center and help sort out clothes for people that need it. We also have deep cleaning opportunities, and one of the ones that people love to do the most is meals. Like I said, we do offer meals for our clients every day, but it's always fun to have someone come in and, you know, bake some pizzas for our clients and be able to share that moment with them. But online, we also do educational and gift card making kind of events. So our really popular one in the last season was making holiday cards, but these can be cards that are applicable to just any situation. Our clients can be isolated, so it's really nice for them to see messages from community members that people support them and really want them to do their best and are there for them.
Awesome. Any other questions for Nicole in Downtown Emergency Service Center? All right, well, any other questions for any of our charities? All right, well, you have their contact information. This recording will be up soon. So just in case you may miss something or you forget their CFC information, you can check that, or you can check online. Again, our campaign ends pretty soon on the 15th. So please make sure that you use our mobile app or you go online to donate. Phil, is there anything else that I've missed?
I don't think so. I just thank you to the charities for sharing your stories and the important work that you guys do in our community and communities. And be sure to make your pledges. And also, I want to add that if a donor has already made a pledge for the year, you can go in and change that and add charities, or you can make a one-time donation also. So that's always an option for folks.
That's right. And if you have any additional questions, you can reach out to myself or Phil, definitely. All right, well, thank you all so much. This is the first time we've actually gone over, so the last one, I guess. But thank you all so much for an amazing campaign. Thank you to our charities today. And again, if you all have any questions for our charities or myself or Phil, please contact us. Thank you again.
Thanks, everyone. Have a good one.
All right, thank you.
Thank you.